What we found was that at baseline, the amount of ctDNA was predictive of survival, and this was in contrast to some other studies earlier that had shown just plus minus whether it was present or absent. We had a very high detection rate. 93% of patients had detectable BRAF-V600 DNA in their plasma using this platform, which is the highest rate so far to date for a similar type of study. And because of the droplet digital technology, we were able to quantify very precisely the amount. And when we analyzed the levels, as opposed to just absence or presence, we found that the levels correlated with outcome in a Cox multivariate analysis. So that was really the first time that's been done. We then looked at patients who, we looked at week 4 samples because that was what was available to us, and we found that the level at week 4 was also predictive of survival benefit. If patients had no detectable ctDNA at week 4, they had an extended progression-free and overall survival, roughly double the patients who had persistent ctDNA detected at week 4. So we're thinking that with additional studies, additional time points, that this may become a monitoring tool for patients and doctors to help more fine-tune their treatment. For example, patients who have a persistently positive ctDNA after starting treatment, doctors may want to add an additional treatment which may have a risk of additional toxicity, but also additional benefit. Whereas patients clear their ctDNA during treatment, they might just stick with what they're on and wait and see if they progress to then add another therapy. So this is what we're thinking could be the future. Of course, additional studies are needed, but it's a very good first step.